Whooping cough is a highly contagious illness. It can be especially detrimental to the very young children and some of our older adults. For many other folks, it can keep them out of work or school for an extended period of time. We're joined again by Community Health Director Lynn Ledford, and you're now joined by Jeffrey Hammerstein from Wake County EMS. Thank you for being here.
Thank you.
We're talking about whooping cough today, and it's an illness that was widely known in the first half of the last century, but it's kind of making a comeback. Lynn, can you explain to us why that is?
We believe that the reason it is coming back is related to a waning vaccine, where people received their vaccine, adults did, sometimes several years back. And the immunity has lessened, and therefore they're more susceptible to the disease. And I believe that sometimes there are people that are not receiving the vaccine as frequently as they should for their children. So between those two factors, I believe that's probably the reason we're seeing an increase.
When we're talking about seeing an increase, Jeffrey, what symptoms would people be looking for in their loved ones or themselves?
So what we're looking for more than anything is a really long, drawn-out cough, the kind of cough that you really just can't recover from. It goes on, and it really kind of takes your breath away. It can be severe and go on for quite some time, including to the point where it actually starts to become very uncomfortable. It's difficult to catch a breath. There may be vomiting. There may be even injury to ribs and that type of thing. So a really drawn-out cough.
The county does have a TDAP vaccination program because whooping cough is one of the diseases that's prevented by this vaccine. Can you tell us about that program?
Certainly. We have actually been pretty rigorous in our efforts to get out into the community. We've worked closely with EMS and some of our other partners in the community to make sure that access is not a problem for people, that they can have the vaccine readily available. We've especially focused on an effort that we call cocooning. The cocooning effort is related to protecting the infant or small child. And the way we do that is to assure that the vaccinated people or the people around them are vaccinated and that they have protection from pertussis, and by doing that we see a decreased incidence in the smaller children. It's very dangerous for a small child.
Whooping cough or pertussis is just one of the diseases that they get protection from with the TDAP vaccine. What are the others?
Okay, diphtheria is one of the different ones, and tetanus. And of course tetanus is one of those that we encourage people to be revaccinated every 8 years anyway. So frequently we say if you can't remember the last time you had this vaccine, you should take this vaccine.
Jeffrey, what are the implications for the community if whooping cough does start to spread, especially for the workforce?
That certainly can be significant because it will put somebody out of work for such a long amount of time, days, weeks even, then it could become quite significant for the community if a massive number of people are not able to come into work. One of the focuses that we've started with, working so closely with the health department, is to make sure that all of the emergency responders in Wake County are vaccinated. By definition of what we do, we come in contact with so many different people, so many sick people across the community. It's important for us to make sure that we are protected first so that we're not carrying, so that we can keep the emergency response workforce at work to be able to respond to the emergencies.
Thank you all for taking the time to be with us. We really do appreciate having both of you here.